What is glaucoma?
The way I like to describe glaucoma is if we consider the optic nerve, the structure that can be damaged in glaucoma, like a cable, the eye is a structure that sees and the brain processes information, and those two things are hooked up. And the optic nerve is the cable that hooks them up. Glaucoma is a condition where that nerve becomes damaged over time. We don't know why exactly that happens is the short answer, but we know there's a number of risk factors related to developing glaucoma. We know increasing age, race, length of the eye, previous trauma, and pressure in the eye are all important risk factors. We can't control, who your parents are or people's background, except we can control the pressure in the eye by using different therapies. That can involve using eye drops, lasers, or surgeries, and surgeons and clinicians look and determine which one is best based on the patient in front of them.
Is glaucoma hereditary?
Yes, glaucoma can be hereditary. It can run in the family. So if someone has a family history of glaucoma, we do encourage them to be checked.
Can glaucoma be prevented?
So the important thing to understand about glaucoma is that it's a treatable condition. A lot of people ask me if there's things they can do in terms of their lifestyle to prevent glaucoma. Can they have a healthier diet? Can they exercise? Really, the truthful answer is that people who are developing glaucoma really have a predisposition to developing it, and those are not major factors in terms of the disease course. So I tell people it makes sense to live a healthy life. We think those factors are important, but the major evidence in terms of managing glaucoma relates around lowering the pressure in the eye.
How does glaucoma affect your vision?
One of the major challenges with glaucoma is that patients don't notice loss of vision until the disease is typically very advanced. It's what we call an asymptomatic disease. And so we really encourage screening for individuals when they go get their eyes checked to get glasses, or probably every 1 to 2 years from when somebody is about 40 to when they're 65.
Can glaucoma lead to blindness?
Unfortunately, glaucoma can lead to blindness, and that's one of the major reasons why screening is so important. If we can catch people early and put them on appropriate treatments, we can preserve a lot of vision for patients, and patients can do very well for a very long time. Unfortunately, if people haven't been checked for a long time and they come to us and they have very damaged vision, it can be harder to ensure that person remains with good vision their whole life. That being said, we still have excellent treatments that can stabilize their vision for the long term.
What are the early signs of glaucoma?
Major symptoms related to glaucoma involve loss of the peripheral vision. For patients, those don't often overlap in both eyes, so they can, sometimes one eye will cover a blind spot in the other eye, and so patients actually, until incredibly late in the disease, feel they're seeing very well. And this can be challenging sometimes with driving. Sometimes patients don't meet criteria for legal driving despite feeling that they can see well. Other problems can include having subtle problems with color vision or contrast vision. Patients don't always complain about this. Other patients sometimes present with glaucoma and they do have changes in their vision close to their central vision. That's probably the minority of patients. However, those patients can present sometimes earlier and be quite troubled.